Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today I'll be speaking about what is bone grafting or bone augmentation. But before we continue, make sure to subscribe down below for more and more similar videos. So let's start now. What is bone augmentation? Bone augmentation, also referred to as bone grafting, is a procedure typically needed when the current bone mass of your jaw is not suitable to successfully incorporate dental implants. Luckily, in this day and age, our doctors are able to grow bone where it is needed. Now, what are the reasons for bone augmentation or grafting? The number one reason for bone augmentation surgery is obviously bone loss. When bone mass is too thin or soft to keep an implant in place, a bone augmentation will help so the bone can fuse to the dental implant and keep it secure. If a dental implant is placed in the jaw where bone structure is not sufficient enough, the likelihood of an implant failing will increase because there will be nothing to hold the implant in place. Now, what can you expect? Before bone augmentation procedure, when a tooth is missing, what happens? Loss of bone may occur at the site of that tooth, enabling the surrounding teeth to shift, or there will be drifting of the teeth. And once there is drifting of the teeth, the space there will close. And because it closed, you will not be able to replace the area with tooth unless you fix the drifting by ortho treatment. And then you can place a tooth, which is the implant. But remember that you need to replace any missing tooth so that you won't end up having bone loss. Normally, after 3 months of tooth loss, jawbone density will slowly decline. During the first 12 months, 25% of the jawbone at the site of the missing tooth will disappear. So you need to remember that once you extract a tooth, after 3 months, there will be resorption of the bone that will take place. Now, during the bone augmentation procedure, fortunately, when bone loss occurs, our doctors are able to pack the site with bone particulates in order to recover the loss that happened due to the resorption. After bone augmentation, the particulates will heal into the existing bone to create adequate bone density for a dental implant to be placed. So after you are done with the bone augmentation procedure or the bone grafting procedure, your dentist will recall you in order to place an implant. Now, the chances of success for the implant after the bone augmentation procedure is higher than before bone augmentation procedure. Now you might ask me, since we are placing bone particulates into the socket, how long does it take for the procedure to be completed? The bone augmentation procedures typically take less than 30 minutes. If an expert implantologist, it takes typically less than 30 minutes. If it's still like he or she is new to the field of implantology, then it takes around 1 hour maximum. Now, what we need to advise you before going into the bone augmentation procedure. At home, do not eat or drink anything for at least 8 hours before your IV sedative procedure. This means no food, no water, no mint, no chewing gum, any of that, to avoid vomiting to happen during the procedure. That's why. Now, after you are done with the procedure, you may notice some of the bone particulates working their way out of the socket. This may feel gritty in the mouth. This is completely normal and no cause for concern. Also, in some cases, a membrane is placed over the socket that will come loose after a couple of weeks, and this is also no cause for concern. So there might be a suture in the socket and the suture will come out by itself. It's okay. Don't worry about that. Now, how long does the bone augmentation will last? Will the new bone that is implanted recently, it will stay just like the normal bone? Generally, a bone graft permanently fuses with your natural jawbone. It can last forever. However, if an implant doesn't replace a tooth, the new bone density will deteriorate gradually due to a lack of chewing stimulation. You can expect significant jawbone loss within the first 12 months. So, after bone augmentation procedure, you need to place an implant in order to avoid resorption to happen back again. Here is the bone grafting process. Before bone grafting, you have resorption or you have bone loss in the area. During the bone grafting, a new bone graft will be placed into the socket. After you are done with the bone grafting procedure, the dentist will recall you to place an implant into the socket. So bone particulates will be placed into the socket in order to compensate for the loss of the bone that happened. Thank you all for watching my video. If you enjoyed, don't forget to press the like button down below and subscribe for more videos. Goodbye now.